Hi, my name is Matthew Moeller, Acting Public Affairs Specialist at Hines VA Hospital, filling in for Director Doling, who is attending a healthcare conference in Orlando, but will be joining us with prepared remarks later on. First, I'd like to share some information about our main hospital, including commonly requested phone numbers, which you can see on your screen. Today's Veteran Town Hall also highlights our Kankakee CBOC. The Kankakee CBOC is located in Bourbonnais, Illinois, and serves 85 to 100 veterans daily. The clinic offers primary care, telehealth, a vascular clinic, home-based primary care, audiology, physical therapy, and much more. Veterans are also encouraged to visit Kankakee's Micro Food Pantry or micro food pantries at any of our CBOC locations. They're open year-round during regular business hours. The Veteran Canteen Service will be extending their shopping hours for the holidays on December 19th and 20th from 6 a.m. to 5:30 p.m. and December 21st and 22nd from 9 a.m. to 2 p.m. Starting in 2025, My Healthy Vet users will need to use login.gov or ID.me to sign into their accounts. After January 31st, 2025, VA will no longer offer My Healthy Vet logins as an option. We encourage everyone to please sign up ahead of time to avoid any delays. Please note that My Healthy Vet is not going away. VA is just changing the way you sign in to make it more secure and better for the veterans. For questions regarding My Healthy Vets, secure messaging, or the new login process, please contact Hines VA's My Healthy Vet office at 708-202-5633. Again, that's 708-202-5633. And tomorrow, December 13th, Hines VA will be hosting a blood drive. We invite all visitors and patients who are able to attend. It'll be from 8:45 a.m. to 12:45 p.m. in the Hines Auditorium. You'll see a QR code on your screen where you can log in and register, or you can show up and walk in if you're able. Now, please enjoy some prepared remarks from Director Doling, who talks about 2025 initiatives for Hines VA.
Hello, everyone. I'm currently attending the National Institute for Healthcare Improvement Conference, where I'm presenting with Ms. Morris and Dr. Richardson on our HRO journey. Unfortunately, I couldn't make today's Veteran Town Hall, but I did want to share a few exciting updates before we end the calendar year. First, I'd like to discuss our elevator modernization plans. Beginning in the spring of 2025, we'll replace one of our main elevators in Building 200. We anticipate this elevator will be out of service for 3 to 4 months. However, we will then continue replacing one at a time each of the other 7 elevators in Building 200 that serve all 15 floors. We'll also be renovating the elevator lobbies to create a more pleasant environment. Later in this town hall, you'll hear more from our engineering team who will be leading this project. We appreciate your patience as we complete the upgrades we need and that our patients deserve. Now let me update you on our CBOCs. Our Aurora CBOC expansion is complete, and we're currently renovating the main clinic, aiming to finish by next month. Expansion projects at Kankakee, Oak Lawn, and LaSalle CBOCs will begin soon and are expected to wrap up in the summer of 2025. And our Hoffman Estates CBOC expansion is slated for 2026. We're also making significant improvements to our electronic health record system. This involves upgrading our infrastructure across the Hines campus and at each of our CBOCs. While this work may cause temporary disruptions, it will significantly enhance our ability to provide efficient, coordinated care. Construction and renovation can sometimes be disruptive, but we want to assure you that we're doing everything we can to minimize any inconvenience. These projects are ongoing and will provide us with modern, efficient facilities. Thank you for your understanding and patience as we work to improve your healthcare experience. Please don't hesitate to ask our staff any questions. We're here to support you throughout these changes and beyond.
Hello, my name is Felicia Percy. I'm with the High Reliability Organization team, and I'll be sharing today's safety story. Last month, a veteran came into the director's office to share a life-changing experience regarding the care he received from the amputation coordinator office here at Hines VA. The veteran served 18 years in the military. 2 of those years were spent in South Korea, where he served as the ammunition records clerk. The veteran expressed he went through feelings of depression, homelessness, and went through traumatic experiences during his time in the service. The veteran described that he was at a point in his life where he felt so low. After initially speaking with the veteran, the amputation coordinator at Hines VA determined that his immediate goal was to help keep the veteran's morale positive and be a support system after learning the physical and mental health hardships that the veteran had gone through in his life. The veteran felt lost after going through a major life change and had no family support. The caring gesture that the veteran received from the amputation service coordinator throughout the process helped the veteran to see a different perspective in life. The coordinator provided the veteran what he needed to heal, as the staff coordinator would not accept the idea of the veteran to give up in life, to feel sorry, or to be a failure to himself. So the veteran began the road to recovery and was able to take control of his life. The care he received from the amputation service coordinator has helped the veteran with his mental and physical healing. There are so many things that could have gone wrong during that time, as the veteran had no support system and would probably have given up his will to live. The amputation coordinator's empathetic, swift, and supportive care helped boost the veteran's morale. The veteran developed a sense of security, which allowed him to feel valued and accepted. Life was worth living for the veteran. So the actions of the Hines staff exemplified the HRO principle of deference to expertise, empower and value expertise and diversity. And this concludes our safety story. Thank you. And next I'll be followed up with the Chief of Staff Medical Update with Lori Luscri.
Hello, I'm Lori Luscri, the Health Promotion Disease Prevention Program Manager, here to talk a little bit about flu and COVID season. 'Tis the season for cold and flu. Please help us stop the spread of germs. There's a few things that we all should be doing during this time of year to help stop the spread. Avoid close contact with people who are sick. If you are sick, limit contact with others. Please stay home if you are able. Wear a mask to reduce the spread of germs. Masks can also prevent wearers from breathing in infectious particles. Cover your mouth and nose when you cough or sneeze. And clean frequently touched surfaces. Next slide, please. A few other tips. Please avoid touching your eyes, nose, and mouth. Wash your hands with soap and water. If soap and water are not available, please use an alcohol-based hand rub. Also, get your annual vaccinations. Next slide, please. On the topic of vaccinations, who should be getting vaccinated? Everyone 6 months old and older should get a flu and COVID-19 vaccine every year because vaccine protection decreases over time. Vaccines protect you and also those around you from illness. Vaccines help protect you from getting sick, but also can decrease the severity of illness or complications from illnesses if you do get sick. If you are someone at higher risk of complications, it's especially important to get vaccinated. People at high risk include young children, pregnant people, and people with chronic health conditions like asthma, diabetes, heart and lung disease, and anyone aged 65 and older. Also, if you recently had COVID-19, you may delay getting a vaccine for 3 months after symptoms. Please talk to your healthcare team. Next slide. It's not too late to get vaccinated this year. We have locations on the Hines campus from 8 to 3:30 p.m. at several locations throughout the main campus, and our CBOCs also offer vaccinations at each CBOC location. All of these are on a walk-in basis, so you don't need to make an appointment. Please just stop by when you're available to get your vaccines. Next up, we have Lee Holloway from Engineering Service to give our engineering update.
Thank you. My name is Lee Holloway. I'm the Deputy Chief Engineer here at Hines, and I want to speak a little bit real briefly about the elevator project that's going on here at Hines and how it would affect our patient and visitors and staff. We have 2 projects currently in the works that we're procuring or has been procured. The first project is the modernization of one of our project's passenger elevator number 2. It is currently going to be renovated beginning January 6th of 2025. That project will entails or involves replacing all the components on the elevator, a full makeover of the elevator, but it's just one particular elevator, so we want to get started with P2. The second elevator project will entail all of the passenger elevators 1 through 5, and the service elevators 1 through 6, and then excuse me. That's going to be a little bit more of an involved project. This is going to involve not only the exterior or the card itself, but it's going to involve some components that you do not see, which is the 15th floor of Building 200, and some of the components in that area. We're also going to replace the software and the motors and the cabling of the cars. That project will start approximately in the early summer or June. We anticipate that the project lasting more than 2 years. Now, how is this going to affect our visitors, patients, and staff? There will be some challenges as far as movement of elevators. We'll be taking down 1 elevator per quarter. This could be 3 to 4 months to repair the elevator. So there will be some challenges as far as people standing in the lobby waiting for elevators. The expected results, we expect the elevator project to last approximately, like I say, more than 2 years. But the expected result is newly refreshed safety, safe elevator transport, and a new refreshed elevator with finishes and flooring and things of that nature. So we fully expect the elevators to work consistently and more dependable elevators experience. So, and that's all I have. So now I'll introduce Mr.
Anthony Merrill.
Anthony Merrill. Thank you.
Hello, my name is Anthony Merrill. I'm with Whole Health. A lot of people ask, so what is Whole Health? In our orientation, we find out that it's an approach to healthcare that empowers and equips people to take charge of their health and well-being and live their life to the fullest. But what does that mean? What does it look like? Well, everyone is different. Everyone's unique. So it looks a little different for everyone. One question that is common to all, though, is what's important to you? For some people, it might be nutrition or exercise or reducing stress. But once we know what the priority is, we look at setting realistic goals for self-care and help shape a personal health plan. It seems to make a big difference once a priority is articulated and a structured plan is built. From there, we start our journey. Once we have set our goal, we look at our tools and resources. Sometimes, in fact, a lot of times, veterans don't know about the resources available to them. These tools and resources not only act as a vehicle towards their goal, but can also help navigate through barriers and obstacles. Some of these resources include, but by no means are they limited to, mental health professionals, a dietitian, a chaplain, a nurse, a whole health team member, a physician, or a member of another service or clinic. I have a friend who's a cancer survivor. At the time when he first went into remission, we were having a conversation about his health. He told me that he had recently seen his doctor and that his blood work and test results had come back and all seemed well. I congratulated him and we moved on to other topics. A little bit further along in the conversation, he told me that he'd been having trouble sleeping for the last few months or so, and he was having difficulty being patient with his wife and son. I asked him what his doctor said. He said, "What? I told you that my blood work and test came back good." And I asked him, "No, what did your doctor say about your sleep?" He told me that he hadn't said anything to his doctor, and I asked him why not. Told him that sleep is part of your health too. He told me that he had never thought of it that way. A week or so later, he brought it up to his doctor. They tried several different approaches before his sleep improved, but it did eventually improve. And so did his relationship with his family. All it took was a single question in a 30-minute conversation to change everything. Understanding your care options and being an active participant in your health choices can be a game changer. Does whole health sound like something that you would like to explore? And next up, we're going to have John Bissard with Limited English Proficiency Program. Thank you.
Thank you. Well, hello everyone, my name is John Bissard. I'm the Equal Employment Manager here at Hines. I'm going to talk to you a little bit about limited English proficiency. You can go to the next slide, please. Now, most individuals living in the U.S. read, write, speak, and understand English. However, there are many individuals for whom English is not their primary language. As an example, based on the Department of Labor census for the year 2010, over 26 million individuals speak Spanish, and almost 7 million individuals speak an Asian or Pacific Islander language at home. If you have limited ability to read, write, speak, or understand English, you may be considered limited English proficient. Language for LEP individuals can be a barrier to accessing important benefits or services, understanding and exercising important rights, or understanding other information provided by federally funded programs and activities. Now, you as a veteran cannot request interpreter services directly to Language Line. However, your providers or other caregiver staff can make those requests on your behalf. Also, for American Sign Language interpretation, that can also be requested through your provider. That should be done at least 24 hours in advance. Thank you very much. Next, some information for you on suicide prevention.
Hello, I'm Carrie McWaters. And I'm Angela Chen. We're with the Suicide Prevention Program, and today we want to talk briefly about lethal means safety. With the upcoming holiday season, this may bring more family and friends coming into your home, and we want to take a moment to discuss making your home safe. Lethal means safety means making sure there isn't easy access to things in your home that can be harmful or lethal. This can include firearms, medications, knives, ropes. And lethal means safety is one of the most important aspects of safety planning. So why do we want to make it difficult to access? As I said, this is part of safety planning. We see that people who are at increased risk of suicide can act impulsively on these thoughts of suicide. With time and space, we give that opportunity for people to have those thoughts to pass, so this in itself will save lives. Angela will explain more about what safe storage can look like. Next slide.
So here are some options for safe storage for your firearms. So the first one is to store firearms unloaded and locked. Number two is to store and lock your ammunition separately from your firearms. The next is to ensure that the key or combination is inaccessible to the person who is at risk for suicide. And then the last one is temporarily removing the firearms from home. Next slide. So here are some lethal means interventions that are available to veterans at Hines for free. So in regards to access to firearms, we have gun locks that are provided, and also lockbox for your firearms, which new to Hines can actually be ordered through prosthetics. Your provider can put in a console through prosthetics for a lockbox. And then access to medications, especially opioids, is pill boxes. We have lock boxes for medication storage, medication disposal bags, and then naloxone can be ordered through your provider. And then all that you have to do for these items is just request them through your provider, and then the items that suicide prevention provides, they would send us an email with your contact information and which items you would like, and we would ship them directly to your house. So that's the end of our presentation. Have a happy and safe holiday season. And next is Don Donahue from the Homeless Veterans Program.
Good afternoon. My name is Don Donahue. I'm the Housing Urban Development VA Supportive Housing, or HUD-VASH, Clinical Manager. I'm here to talk about all our homeless programs. Underneath the homeless umbrella are 5 programs: the Healthcare for Homeless Veterans Outreach Team, Grant and Per Diem, Contract Emergency Residential Services, Low Demand Safe Haven, the Veteran Justice Outreach, and then finally the HUD-VASH team. Next slide, please. The purpose of the homeless program is to end veteran homelessness. So any veteran that we're working with, we will be working on establishing housing stability, helping a veteran increase their financial stability, and also working with them to become clinically established, i.e. established with medical providers, mental health providers, any type of providers the veteran is requiring or requests. We have a walk-in office. It's located in building 228. We're located on the 4th floor, north side. Our walk-in hours are 9 to 3. And it's staffed by a social worker who will make immediate referrals to community agencies, emergency housing, shelters, transitional housing. It's same-day assistance and practical supports. Next slide, please. The Healthcare for Homeless Outreach Case Management Program. Generally, veterans are referred to this program from the walk-in clinic or sometimes through consults. We have staff who are outreaching in the shelters and on the streets, and so we're connecting with veterans and seeing if they're interested in case management, and then we're working with them to try to get income, housing, get them connected to medical care, mental health care, get them connected to whatever resources we think would be beneficial for them. One of our outreach programs is the Veteran Justice Outreach. Its primarily focus is to engage veterans that are connected to, that are justice involved. Ideally, we're connecting with the veteran just after they're arrested. They're just involved in court, and we work with the court system in veteran treatment courts to try to see what we can do to help the veteran get the needed services to limit consequences for choices or to help have better outcomes in court. We also have a social worker that does outreach in prisons and connects with veterans who are coming out of prison so that they get connected to the required care once they get discharged, get assistance with housing, and help with getting reestablished financially. Under the Veterans Justice Outreach Program is a couple other tasks. We have a connection with the state's attorney's office, and they can help veterans with child support issues in the state of Illinois. And they're able to sometimes adjust what a veteran is paying based on their situation or based on if there's been a drastic change in their income. Next slide, please. The contract emergency residential services and low demand safe haven are emergency housing placements. They're different type of placements. That's why the different names. Generally, a veteran might come to a walk-in clinic. They have no place to stay. We can generally find a bed at one of these places that day, or sometimes right around now. Sometimes it might take a day or two, but we oftentimes have beds at 4 different facilities where we can help a vet stay for up to 120 days. Contract emergency residential services are more short-term. They're limited case management services on site. Low demand safe haven has a little bit more intensive structure and a little bit more intensive services on site. Grant and per diem is another type of transitional housing. Vets can stay up to, in grant and per diem up to 6 months, sometimes a lot longer. But generally we're working to get vets that are in grant and per diem housed within 6 to 9 months. There's case management on site, and we work with vets in these programs to try to get connected to the hospital and financial resources so they can achieve independence. Next slide, please. One of the things that I wanted to highlight here is that we are connected with all the homeless systems within the Hines catchment area. We have a coordinated entry specialist that reaches out to all the homeless continuums. And so when veterans come to a shelter in Cook County, DuPage, Kane, and they identify themselves as a veteran, we usually are notified within a day or two that a veteran's at such and such shelter and needs outreach, and we usually can connect with that shelter or the homeless provider and outreach that veteran. Next slide, please. Next slide, okay. And then finally, I wanted to talk about the HUD-VASH program. A HUD-VASH program is targeting veterans who are at risk of homelessness, who are homelessness, housing insecure. In that program, we can help a veteran get a housing choice voucher. Housing choice voucher assists with rents. And then once that veteran has a housing choice voucher, we help them find an apartment. We help them generally get security deposit. We can oftentimes find furniture resources, help someone get established in housing and get into an apartment that they can afford and they can maintain. With that comes case management. As long as a veteran has a HUD-VASH voucher, they participate with the HUD-VASH case manager. And during that case management, again, we're working to increase income, help people get connected to the medical care they need, and help them achieve whatever goals they are working on. We have vouchers in Cook County, DuPage, Aurora, Joliet, Elgin, and DeKalb. And we oftentimes are able to transfer vouchers to some of the other counties within our catchment area as well. Next slide. I want to thank you for your time. The program is managed by 2 of us. I manage the HUD-VASH program. Golisha English manages much of the outreach and transitional and emergency housing. I have listed our program number, which is 708-202-4961. Please call us, leave a message, we will reach out. There's also a national call center that is manned 24/7, 1-877-424-3838. And thank you. And following me next is Matt Moeller.
Well, as you can tell from my tie, the holiday season is here, especially at Hines. So I'd like to share a couple of updates for events that are happening around the holiday season. Tomorrow at 11 a.m., that's December 13th at 11 a.m., students and young adults will sing Christmas carols in our CLC. On Sunday, December 15th, Do Good Inc. will be wrapping gifts in our auditorium, which will then be given out to veterans at our hospital on December 21st at 9 a.m. If you'd like more information about these events, please contact Renee Rouse, our Chief of Volunteer Services. That's renee.rouse@va.gov. Or you can call her at 708-202-2938. That number again is 708-202-2938. And one more holiday event coming up on Friday, December 20th. We'd like to invite you all to our main lobby where we'll have Hines staff serenading us with Christmas and other holiday carols. Last, we received a question from Keith, which you'll see on your screen right now. Keith said, many of us have used a certain type of medical equipment for years, whatever it may be, and have gotten used to the equipment and how it helps us. If the equipment is going to be charged or discontinued, can we be notified that there is a plan for a change before it happens? For many of us, a change in equipment can be very hard. Keith, we hear you, we understand. We always try our best to make sure veterans know of any equipment changes or any type of changes in their care well in advance of time. We'd like to ask you, please send us a direct message on our Facebook feed. We'd like to know more about your situation and figure out what we can do to find a solution for you. If you have questions, please go ahead and drop them in our chat below, or send us a direct message on our Facebook feed or to hinespublicaffairs@va.gov. Thank you all for joining us, and our next town hall will be February 12th at 5 p.m. on Facebook. Thank you and have a good night and happy holidays.